What is a post-traumatic stress disorder? Welcome back, mental warriors. Today we're going to talk about PTSD, or post-traumatic stress disorder. PTSD is one of the mental health conditions which is caused by a terrible event that the person has experienced or she has been a witness of a traumatic event. Most of the people that go through a traumatic event might have some difficulties to adjust and cope with things. Sometimes with self-care and time, the person can get better. In some other cases, if the person has more symptoms that can last for weeks, months, or years, this can get in the way of everyday functioning of the person. She might have PTSD. Which symptoms show that you have PTSD? PTSD symptoms start within 1 month of terrifying event, but sometimes they can start a few years after the traumatic event. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. These symptoms can be put in 4 groups: change in emotional and physical reactions, avoiding things, intrusive memories, negative change in mood and thinking. Symptoms vary from a person to a person, and over the time they can change. Symptoms of change in emotional and physical reactions: overwhelming shame or guilt, aggressive and irritable behavior, and angry outbursts, trouble with sleeping and concentrating, self-destructive behaviors such as driving with a high speed or drinking a lot, being frightened or startled easily, always being alert for danger. For kids that are 6-year-old or younger, symptoms can be also included: nightmares, which may include scenarios from the traumatic experience, reenacting the terrible event while playing, avoiding things. Avoiding symptoms can include not talking or thinking about the terrible event, to avoid people, activities, or places which remind the person of the terrible event. Symptoms of intrusive memories: unwanted, recurrent, distressing memory of the traumatic experience, flashback, nightmares and bad dreams about the terrible event, severe physical reaction and emotional distress to things that remind them of the traumatic experience. Symptoms of negative change in mood and thinking: feeling numb, difficulty while expressing positive emotions, negative thoughts about the world and other people, pessimistic views about the future, problems with memory including not remembering some parts of the terrible event, difficulty of maintaining close relationship and positive thoughts, detaching from friends and family, not being interested in things that the person once enjoyed. Symptoms intensity: over time, the symptoms of PTSD may vary and intensify. If you're stressed, you can have more PTSD symptoms. When to visit a doctor: if you have severe disturbing feelings and thoughts about a terrible event that lasts more than a month, you should definitely seek for medical help. It's important to get the help in the earlier phase, which can help in prevention. Traumatic events that can cause PTSD are accidents, combat exposures, physical abuse, to be threatened with some weapon, physical assaults. Complications: PTSD can also increase the risk of other mental health issues such as anxiety and depression, alcohol or drug use, eating disorder, suicidal thoughts and feelings. Prevention: if you get help on time, you can prevent stress reactions to get worse, and you will prevent it to develop into PTSD. Turn to your friends and family for support and comfort. You can also seek professional help from a psychologist or psychiatrist. Take care of your mental health, and thank you for watching. We would really appreciate if you subscribe and like this video so we can continue sharing mental health content.